Bismillahirrahmanirrahim. Quote of the day is Allah does not burden a soul beyond that it can bear. This is the quote from Quran. My name is Dr. Aamna Khalid. I am resident of community medicine and I will be presenting the topic of mortality in infancy and childhood under the kind supervision of Professor Dr. Sahara Asal, who is the Institute of Public Health, Lahore. The major learning objectives of today's presentation are we will define infant and childhood mortality, explain the different mortality indicators. We will describe global and Pakistan specific burden. We will identify major causes and determinants, and then we will do the practice of MCQs. So the child mortality matters because the children are the most biologically vulnerable group. More than 90% of the under 5 deaths are preventable, and it reflects maternal health, nutrition, socioeconomic status, and health system strength. And this is the core indicator of national development as well. These are some of the key definitions. Infant mortality is labeled when death occurs before 1 year of age. Neonatal mortality is the death within first 28 days of the life. And post-neonatal mortality is the death from 28 days to 1 year. Child mortality is the death between 1 to 4 years. Under 5 mortality is the death before 5 years of age. Uh, first of all, we will see the formula of a neonatal mortality rate. In the numerator, we can see that there are the number of deaths of live born infants within 28 days of birth in a year. And in the denominator, we will keep total number of live births in the same year. And we will multiply it with a multiplier, 1000 in this case. Then the next one is we can divide neonatal mortality rate into further two groups, early neonatal mortality and a late neonatal mortality. Early neonatal mortality is when deaths of live born infants occur within 0 to 6 days of life, and the denominator is again total live births. And late neonatal mortality rate is when deaths of live born infants occur from 7 to 28 days of life, and again the denominator is total live births. The next one is infant mortality rate, that is the number of deaths of children under 1 year of age in a year, and denominator again total number of live births. And then we have post-neonatal mortality rate, means the deaths of infants aged 28 days to less than 1 year, and denominator is again total live births. Then on number 6 we have child mortality rate, the deaths of children aged 1 to 4 years in a year, and now we will take the denominator as mid-year population of children aged 1 to 4 years. Then we have under 5 mortality rate, whereas the numerator we have number of deaths of children under 5 years of age in a year, and in denominator we will see the total number of live births in the same year. On number 8 we have perinatal mortality rate. It means that it includes two indicators. It's a combination of two indicators. First one is the late fetal deaths, means all the deaths which occur uh, at or after 28 weeks of gestation. And the second indicator is the early neonatal death, that is 0 to 7 days of life after the baby is born. So we combine two of the indicators, keep them in the numerator, and in denominator we again have total births, including the live births and the stillbirths. On number 9 we have stillbirth rate. It means we will keep the only one indicator, that is the number of stillbirths, the stillbirths or deaths that occur at or after the 28 weeks of gestation, and in the denominator we have the same total births, live births plus stillbirths. In the fetal mortality rate, we will keep the numerator as number of fetal deaths in a year, and we will divide it by the total births live plus fetal deaths, and we will multiply with a multiplier. So the major focus is on the thing that what are the causes of different mortalities, so we can focus on the prevention of all of them. So first of all, we will discuss the causes of neonatal mortality. The major cause is prematurity and low birth weight, birth asphyxia, neonatal sepsis and pneumonia, congenital anomalies, and neonatal tetanus. When we talk about post-neonatal mortality, the major causes are acute respiratory infections and diarrheal diseases, malnutrition, vaccine-preventable diseases, and poor infant feeding practices. So this neonatal mortality is a critical period because it carries the highest risk of death. Most deaths occur within the first 24 hours and the first 7 days of life, and it is closely linked to the quality of antenatal and delivery care. Then the major causes of child mortality means the death that occurs from 1 to 4 years. The causes are pneumonia, diarrhea, measles, malaria, if it's localized or endemic in some area, injuries and accidents, and severe acute malnutrition. So now we will discuss the role of malnutrition in the deaths of infants and children. Malnutrition is the underlying factor in approximately 45% of the under 5 deaths, and the common forms include stunting, wasting, and micronutrient deficiencies. And the malnutrition leads to poor immunity and severe infections. Then there are some biological determinants that the baby might have low birth weight, prematurity, short birth spacing, high parity, and teenage pregnancy. Some social determinants are poverty of the family, low family literacy, gender discrimination, cultural practices, delayed care seeking behavior. These are some of the health system determinants, which include inadequate antenatal care, unskilled deliveries, weak referral systems, limited medical intensive care facilities, low immunization coverage in some districts. The environmental determinants include unsafe drinking water, poor sanitation, indoor air pollution, overcrowding, and poor housing conditions. So now we come to the global magnitude of the problem that millions of the children die annually before reaching age 5, and there is the highest burden in South Asia and Sub-Saharan Africa. Neonatal deaths account for about 50% of the under 5 deaths. This is the comparison of child mortality in different years. First of all, you can see that in 1800s, um, a whole of the world was afflicted with the child mortality, and the whole of the map is in the red color, showing high prevalence or rate of child mortality. Then on the second number, we have child mortality shown from the data of 1950, and now some areas are we can see the green side. And then we have the child mortality. So that we have a lot of better, and we don't see the same country is showing better countries. Better than the high mortality rate. So conditions are better, but things needs to be improved further. So this is the map. Uh, this is the map showing child mortalities. I'm so sorry. Um, okay. And this is the child mortality estimation. And you can see that Pakistan is in orange color, and that ranges from 5 to 6% death rate, while more than half of the countries are in green color, that they have reached the target which was set to minimize the child mortality. This is the map showing of the I can see the heading actually. Okay, this is the map showing the infant mortality rate. The data is from 2023, and again you can see that Pakistan is in a darker zone, ranging from 5 to 10%. This is the new neonatal mortality rate map. Data is from 2023, and the neonatal mortality rate is a serious issue in Pakistan. You can see that the color of our map is really darker. It's from 3.5 to 4%, and only one or two countries are facing the problem more than Pakistan. Otherwise, all of the countries are more or less in a better condition than our country. So the global trend is that there is significant decline in the under five mortality since 1990, and the decline is slower in the neonatal mortality as we have seen in the previous maps. And there are wide inequities that exist between countries and within countries as well. So this is again a comparison of different years. The lighter red color is the lighter red color is for the under five mortalities, and the darker and maroon color is for the first 28 days of life, like the neonatal mortality. And you can see that although there is a decrease in the length of the bars starting from 1993 till 2023, and under five mortality has increased, but neonatal mortality also has increased since 1993, but the decrease in comparison to the under five mortality is still slower. So for the condition of Pakistan, we can see that under five mortality rate is approximately 58 per 1,000 live births. Infant mortality rate is approximately 50 per 1,000 live births. Sorry. Neonatal mortality rate is approximately 38 per 1,000 live births, and Pakistan contributes a large share of global under five deaths. If we break it down to the daily burden, then around 675 newborns die every day. Approximately 4 lakh under 5 deaths occur annually, and majority of the deaths occur at home in rural areas and within the first month of life. Again, neonatal mortality. So these are some of the provincial and social inequalities which lead to the higher mortality rates. That the mortality rate is higher in rural areas compared to the urban areas. It's higher among the poor households. It's higher among mothers with no formal education, but provincial variation exists across different provinces as well. So again, this is a map showing the death rate from neonatal preterm birth complications. The data is from 2021, and again, Pakistan is in a darker shade as compared to its neighboring countries, Afghanistan and in India, and the shade ranges from 205 500 deaths. These are the causes of death in children under 5. The data is from 2021, and we can see that the highest burden is contributed by the neonatal preterm birth, followed by neonatal asphyxia and trauma on the second number, and then the infection like pneumonia, and then congenital birth defects, and then we have a range of the infections starting from malaria, diarrhea, neonatal sepsis, and different infections which are basically preventable. This is again the major causes of child deaths, and the picture is again showing the same causes. So how we have to prevent this high mortality um, in infants and children? The one strategy is continuum of care, that the care should start from the pre-pregnancy period. There should be proper family planning, and adolescent nutrition should be addressed. During pregnancy, we need to focus on the antenatal care, tetanus toxoid vaccinations, iron and folic acid supplementations. During the intrapartum and neonatal care, we need to improve the percentages of skilled birth attendants, clean delivery practices, early initiation of breastfeeding, kangaroo mother care, neonatal resuscitation, and infection prevention. This is just a pictorial manifestation of how to hold your baby during the kangaroo care, as we have seen that preterm birth was the major cause of death in the neonates. So this was a strategy to improve the a survival status of the neonates. It includes 8 steps. First of all, remove your clothes of your baby. Uh, You can leave their nappy or diaper on. On second number, they say that remove your shirt and anything in the way. Hold your baby upright with their head on one side. Place your baby between your breasts. One hand should support your baby's head. The other hand should support their bottom. Wrap your clothes or a blanket around your baby in a kangaroo-like pouch, and you can use a mirror to see your baby's face. So these are some of the interventions for child survival. There should be exclusive breastfeeding for first 6 months. There should be appropriate complementary feeding after 6 months. Full immunization should be followed as per the schedule of the country. Vitamin A supplementation, ORS and zinc for diarrhea, early treatment of pneumonia. These all should be available. Immunization is as well a cornerstone which prevents many preventable diseases like measles, diphtheria, pertussis, tetanus, polio. And this is cost-effective and life-saving intervention, and it's implemented through EPI, that's Expanded Program on Immunization in Pakistan. So this is the map showing how the EPI was established and how different vaccines were introduced in different years. It was started in 1978. Pilot project was actually done in 1976 and established in 1978. Then activities were intensified in 1981. Then National Polio Immunization Days were introduced in 1994. Then hepatitis B vaccine was introduced and pentavalent. Then pneumococcal, then inactivated polio vaccine in 2015. Then rotavirus in 2017. Typhoid conjugated vaccine in 2019 in Sindh, and measles, rubella, and TCV like typhoid in other provinces in 2021. And in 2022, TCV was introduced in the remaining regions. So this is how immunizations are done at different age groups, and covering different diseases which are preventable. Then the other approach is community-based approach, which can include different things like we can promote lady health workers program, home-based newborn care, growth monitoring should be done, the proper growth chart should be maintained, maternal health education, and they should be educated about the early recognition of the danger signs of pregnancy. Then integrated management of childhood illness has to be implemented properly. This is a strategy developed by WHO and focuses on integrated case management, strengthens the health worker skills, improves health system performance, and addresses major diseases like pneumonia, diarrhea, malaria, malnutrition, and ear problems. For 2030, the SDG goals are like this, that Sustainable Development Goal 3 focuses on good health and well-being. So the target 3.22 was to end the preventable deaths of newborn and children under 5 years, to reduce the neonatal mortality to 12 per 1,000 live births till 2023, uh, 2030, sorry, and reduce the under 5 mortality to 25 per 1,000 live births by 2030. These are again some of the challenges in Pakistan, and we have rapid population growth where there are health inequities, climate-related disasters. We are facing conflicts and displacements, and there are weak data and surveillance systems. We need to focus on all of these problems. And so again, the recommendations are again focusing on the problems that we have to strengthen our primary health care. We have to focus on the neonatal survival, improve maternal nutrition, expand community-based care, achieve universal health coverage, and promote multi-sectoral collaboration. So concluding the topic, uh, reducing infant and childhood mortality requires strong health system, empowered mothers, community participation, and political commitment as well. So quickly going through this data available on UNICEF to see the recent advances we can apply to reduce the mortality. And this is the slogan present on UNICEF that a geographical coordinates of where a child is born should not determine whether they are given a birth and death certificate within the first 5 years of life. While this is for the million of the children today, but it does not have to be for coming generations. So they have highlighted some of the um, improvements in the technology or introduction of the technologies which have improved the survival. The first one is that there is a pioneer effort in Latin America for the medical drone delivery services, and they saw that 10 newborns received drone delivered breast milk at its initial use. And then second was a mobile app which helped care for 6,45,000 children, providing evidence-based guidance to parents of children aged 0 to 60 years. Then another one was that the AI and machine learning tool created was to facilitate the neonatal sepsis, scoring for 1,800 babies in India. Then using the blockchain, an electronic prescription platform was created to help 3 lakh children, and then an AI-powered eye screening tool had 5,000 children in the foster care, and then an AI-assisted respiratory disease diagnosis aided 2,000 children. More technologies designed specifically to deliver efficiently and effectively in the resource constrained settings. So this was all about today's topic. Now we come to the practice of MCQs. Question number one is a baby born at home in a rural area develops difficulty in breathing and poor feeding on the second day of life and dies on day 3. This death will be classified under which mortality indicator? Option number A, infant mortality. Option B, postneonatal mortality. Option C, perinatal mortality. Option D, neonatal mortality. And option E, under 5 mortality.
C.
D.
Yes, D is the right answer because he died on day 3. So this is neonatal. Uh, Question number 2 is a country has reduced its under 5 mortality significantly, but neonatal mortality remains high. This indicates failure mainly in which areas? Option A, immunization coverage. Option B, school health services. Option C, antenatal, intrapartum, and the immediate newborn care. Option D, management of diarrhea. And option E, vitamin A supplementation.
Charlie.
C. C.
Yes, Charlie is the right answer. Question number 3 is a 10-month-old infant presents with acute watery diarrhea and dehydration. The child later dies due to delayed treatment. This death falls under which category? Option A, neonatal mortality. Option B, postneonatal. Option C, child mortality. Option D, perinatal mortality. And option E, stillbirth.
D.
Yes, option
D.
B. B is the right answer. Post neonatal mortality, which ranges from 28 days till 12 months. All right. And then question number 4 is a public health officer wants to assess overall child survival status in Pakistan. Which indicator is most appropriate? Option A, neonatal mortality rate. Option B, infant mortality. Option C is child mortality rate. Option D, under 5 mortality. And option E, perinatal mortality rate.
D.
D. D.
Yes, option D is the right answer because we have used the word overall child survival status. So option D is the right answer. All right, question number 5 is a mother delivers at home without a skilled attendant. The newborn develops fever and poor feeding on day 5 of life and dies 2 days later. Which cause is most likely responsible for this death? Option A, birth asphyxia. Option B, congenital anomaly. C, neonatal sepsis. D, prematurity. And E, sudden infant death.
C.
Yes, option C is the right answer. Question number 6. Our district shows high neonatal mortality despite good immunization coverage. Which intervention would be most effective? Option A, introduction of measles vaccine. Option B, vitamin A supplementation. Option C, skilled birth attendance and clean delivery. Option D, school health education. And option E, deworming program.
C.
C.
Yes, C is the right answer as we are focusing on the neonatal mortality. Question number 7 is a 3-year-old child dies due to measles complications. The death is best categorized as option A, neonatal mortality, B, postneonatal, C, infant, D, child, and E, perinatal mortality.
D.
Infant. C.
Like, she is 3 years old. She is 3 years
D.
old. So this comes under child mortality from 1 to 4 years. Then we have which determinant most strongly explains higher infant mortality in rural Pakistan compared to urban areas. Option A, genetic differences. Option B, high fertility alone. Option C, limited access to skilled healthcare services. Option D, seasonal variation. And option E, cultural food preferences only.
C.
C.
Yes, C is the right answer. Question number 9, a newborn dies within the first 24 hours due to failure to breathe at birth. What is the most likely cause? Option A, neonatal sepsis. B, prematurity. C, birth asphyxia. D is congenital infection. And E is hypothermia.
C.
Yes, C is the right answer. Last question is a community-based intervention most effective in reducing neonatal mortality in Pakistan is option A, growth monitoring, or option B, school health services, C, home-based newborn care, D, deworming, and option E, adolescent vaccination.
C.
Yes, C is the right answer. This is the answer key to all of the questions. Thank you so much.
Thank you. It was a wonderful presentation.
Thank you, Dr.